going to go over major or mild neurocognitive disorders due to Alzheimer's disease. So the first thing that I wanted to do is go over the APA DSM-5 criteria for major or mild neurocognitive disorders as a result of Alzheimer's disease. So the first criteria that needs to be met for either major or mild neurocognitive disorder is that related to Alzheimer's is that first they must meet the criteria for just major or mild neurocognitive disorder. So the criteria that we went through in the introduction, that must be met first in order for it to be considered to be related to Alzheimer's. The second criteria that needs to be met for neurocognitive disorder due to Alzheimer's is that there is an insidious onset of gradual progression and impairment in one or more cognitive domains. So for major neurocognitive disorder, it needs to be at least 2 domains that are impaired, whereas for minor, it needs to be just at least 1. And then the third criteria is that criteria are met for either probable or possible Alzheimer's disease as follows. So these ones are a little bit different based on whether it's major neurocognitive disorder or mild neurocognitive disorder due to Alzheimer's. So we're going to start with major neurocognitive disorder. So probable Alzheimer's disease for a major neurocognitive disorder due to Alzheimer's is the probable Alzheimer's would be diagnosed if the following is present. Otherwise, it would just be considered possible Alzheimer's disease. So the first thing that must be present for probable Alzheimer's is evidence of causative Alzheimer's disease, genetic mutation from family history, or genetic testing. And then the second thing is that all 3 of the following criteria must be present. So first is clear evidence of decline in memory and learning and at least 1 other cognitive domain. So memory, learning, and then at least 1 other one. And this needs to be based on a detailed history or neuropsychological testing. The second one is steady, progressive, gradual decline in cognition without extended plateaus. So continuing to decline without long, breaks where you're not making any declines. And then the third one is no evidence of mixed etiology, so no other diseases that could really kind of explain the decline. So like other neurodegenerative diseases, other cerebrovascular diseases, or systemic diseases like thyroid disorders or renal failure or anything like that that could affect that. So that is the criteria for C for major neurocognitive disorder. For mild neurocognitive disorder, for C, again, probable Alzheimer's disease is diagnosed if there is evidence of a causative Alzheimer's disease genetic mutation from either genetic testing or family history. Possible Alzheimer's disease is diagnosed if there is no evidence of a causative Alzheimer's disease genetic mutation from either genetic testing or family history, and all 3 of the following are present. So, number 1 is clear evidence of decline in memory and learning. So, this is different from major neurocognitive because that one had to be decline in memory, learning, and another cognitive domain. For mild neurocognitive disorder, it's just clear evidence of decline in memory and learning. Number 2 is steadily progressive, gradual decline in cognition without extended plateaus. So again, continuing to decline without kind of breaks in the decline for a long period of time. And then again, the last part is no evidence of mixed etiology, no other diseases that could explain it, like systemic diseases or other neurological conditions that could explain it. And then the last criteria for both is that the disturbance cannot be better explained by other diseases. Some risk factors that can put people at a higher risk of developing a neurocognitive disorder due to Alzheimer's include traumatic brain injuries. Having a traumatic brain injury at any point in life makes you more likely to develop that. Age, as Alzheimer's is typically something that is present in the older years. And then lastly is genetics. Alzheimer's can be genetic, and again, in order to have probable Alzheimer's disease, you would need to have that genetic mutation either documented in your history or through genetic testing. Some cultural issues with this diagnosis are that people of lower socioeconomic status can have a more difficult time getting this diagnosis for kind of two reasons. The first reason is that people would consider it more normal for somebody of lower socioeconomic status to have these symptoms based on like stress and other things that they might be going through. And then the other kind of factor to that is that people of a lower socioeconomic status may not have access to medical care or decent resources to get the diagnosis of Alzheimer's and eventually major or mild neurocognitive disorder due to Alzheimer's. And then for differential diagnosis, so some other things that should be considered prior to an Alzheimer's diagnosis would be other neurocognitive disorders like Lewy body disease and frontotemporal lobar degeneration, other neurological or body system diseases like a thyroid disorder, and then major depressive disorder as the lack of concentration that's present in major depressive disorder can mimic neurocognitive disorders at some point.